I suppose initially I was interested in adding another skill to my skill sets and broadening my diversity in practice. I work in general practice and I was seeing a lot of families with young children. And so I did the traditional 2-year mechanical orthodontic course. And I just found that there was minimal training in the early orthodontic area. And I really did want to be able to help those children. And so I started to explore the best methods out there or different methods in order to be able to bring that in confidently as part of my practice.
The training that you did was very similar to my training, and we spoke about that. And there was big modules on phase 1 therapy, but it seemed like it was just going through the motions.
Yeah, absolutely. I suppose probably the key difficulty was lack of additional support in terms of the training. And so then I struggled to have confidence in putting some of those appliances in motion. A few of those courses do have quite grand claims in terms of outcomes that you can perform. And a lot of them don't really show you the cases all the way through, or really how, and if they do, really how they get from, that beginning all the way through to the end. So they still left a lot of voids. I did try with some of those appliances, and I was finding, and probably for a number of reasons, that it wasn't giving me the consistency of results that I wanted that helped give me confidence to keep pursuing it. So I was still, I guess, looking for another system.
I suppose one of the aims of my protocols is to be able to provide consistent, reproducible outcomes, positive outcomes.
Having like clear protocols, and not just the protocols, but being so systematic and routine with our assessments, really through that mentorship, just really that kind of strict process whereby you're really validating and confirming everything so that you're able to make a good diagnosis before you're starting treatment. Also, my photography skills improved exponentially from the training you gave us with photography. All of those skills combining to get a really good, consistent set of records. Probably one of the things that's and just the ordering of your thinking by the methods that you've set up to really help you think about a case before you start it. That's probably one of the biggest things that I got out of all of it, just that an ability to then order your thinking and come up with a good diagnosis, etiology, and a comprehensive workable plan, but also really screening your cases. I say no to a lot of cases for a multitude of reasons, and it's through some of those screening tips that and methods that you taught us, because sometimes you need to have quite a bit of confidence as well to say no, like, no, that this isn't a good case. I'm not necessarily going to be able to get the outcome I want with this case, and refer them on. Like I've now got a very clear idea of what I can get consistent results with, and that's what I do. And if I don't think that I can get that, I don't start.
It's a terrible lesson to learn if you experience that yourself, starting something that you can't finish. And having I suppose the experience to be able to pass that particular skill set onto you, I think is something that I would have really appreciated myself, because obviously I wouldn't be as skilled today if I didn't make all the mistakes and found a way to overcome them. But it wasn't a very nice kind of 10-year period. We had a 2-week get-togethers in group sessions, and I think you were in at least for the 12-month block. How did you find that to be too much? Was it just enough? Was it how did you find juggling
Yeah, I
everything
mean,
else?
I think in the end, yeah, I did over 12 months. I was almost close to 18. It was a big commitment, but of huge value for me through that period of just in terms of being able to have the opportunity to have my cases looked at in detail, sort of step by step, just really helped me consolidate all of my knowledge that we'd learned through the courses. And it really helped cement its application in a practical sense. And through that, it's hugely improved my confidence. But those cases that come through and the improvement that you see in those kids and the facial improvements in their growth that you get, and you just see after, once you're 3 or 4 months into the treatment, they just walk into the room straighter with a big full smile. I've got one case that I just found so motivating because, she was class 1 crowded. She wasn't really severe, but looked untidy like it can, struggled to breathe through her nose, all sorts going on with her swallow and how she's eating and poor oral rest posture. And doing those some expansion for her and doing those GoPex exercises, her face completely changed, her confidence completely changed, and she turned from a non-sporty kid to a kid that was winning races at the Surf Life Saving Club. And I've got quite a few patients like that I can tell stories about. And this isn't just about straightening teeth. It's about their whole health. It's helping them breathe better. It's helping their posture, which has knock-on effects in their confidence in their smile, their confidence in life and their health. And that to me is what's so hugely rewarding with it and why I continue. And your course has helped me consolidate all the bits of information I've had from previous places, but make it ordered, helped me justify it in terms of, all the really detailed research that you've looked through and, really helped us interpret and show us. Because as a dentist, and especially when you're treating children, you also really want to be 100% confident and comfortable that you're going to make a positive difference and that you're doing the right thing. And until I did your course, didn't have the confidence to necessarily recommend the treatment.
That really is what we need. We need people to start small and to be consistently good and to build value into the community that you live in. And it really warms my heart to know that you are making that difference in your practice and in your part of the world. And I really thank you for sharing that with us tonight.
Yeah, not a problem, Simon.
Excellent. Thank you, Emma.